Hi. My name is Mara Koffmann, and I am the co-founder and CEO of Braintrust. We are a platform where parents can connect with certified teachers and learning specialists for private tutoring. Today, I am here with Dr. Melissa Marcus, and we are going to be talking about cognitive behavioral therapy, otherwise known as CBT. I'm going to begin by passing it over to Dr. Marcus to give us a little bit more about her background, and then we will dive right into it.
Sounds great. Well, thank you for the brief introduction. Happy to be a part of this conversation today. So my name is Melissa Marcus. I am a clinical psychologist at Milestone Psychology, and I specialize in CBT, which is why it's very exciting. We get to talk a little bit about that today. What I do primarily is therapy for children and adolescents who may have anxiety, OCD, mood disorders, and also just help them live the best life that they can in New York or wherever they might be right now.
Wonderful. And, just in general, I feel like CBT is a term that we often hear, but what exactly is cognitive behavioral therapy?
Yeah, so that's a good question because I know it gets thrown around a lot without everyone always fully understanding what is behind it. So CBT stands for cognitive behavioral therapy. And so like the name, it involves both cognitive and behavioral aspects. So cognitive elements of CBT include identifying thoughts, any sort of what we call cognitive distortions or thinking traps, then working to challenge these thoughts and create more realistic or adaptive thoughts. And then the behavioral element of it really includes learning coping skills. And so common ones that you're probably hearing these days are deep breathing or any sort of visual imagery, as well as what we call exposure work, which involves confronting one's fears or gradually learning to tolerate distressing or stressful things. So for example, someone with test-taking anxiety may practice taking a time test for a few minutes at a time and then slowly work up the ladder until they've reached the full amount of time that they're expected to take that test. During these exposures, what's really important is that people really learn how to tolerate these uncomfortable sensations. And it's not necessarily that this discomfort will go away completely, but people learn how to cope through it to get through it and then realize, okay, I've gotten through this, I can do it next time.
Mm-hmm. And so I know that you mentioned anxiety or emotional or mood challenges or disorders. What sorts of challenges are typically a good fit for CBT?
Yeah, so I think that in general, I'd say CBT can be a good fit for a lot of different people with a lot of different challenges. Generally, I think that it really is helpful for people that have anxiety or OCD, pretty much the ones I just described. But there's so many different adaptations of it that it really can be used for a number of different issues that might come up.
And how long is treatment usually take?
Yeah, so it's hard to give a just straight up answer with that. I think that it's really dependent on the clinical concern, history of presenting problems, any sort of prior treatment, as well as age. So I'd say if it's a really straightforward concern, like let's say a child comes in and says, I have a fear of spiders, and that's it, which happens, but also is rare that there's really just one specific thing going on, then I might say, okay, treatment can take anywhere from 8 to 12 weeks, kind of best case scenario. But frequently what happens is that there are other issues that might come up and then treatment might take a turn or an additional goal may be added. The thing is also older kids, and by older kids, I mean maybe around 10 and up into the teen level. What happens is that they've had more practice generating a lot of maladaptive thoughts or certain behavioral patterns. So then in treatment, it takes a lot more time to undo those and to figure out new ways to cope or new ways to get through. So it may take longer just to break down those habits. And I always say, ideally, we don't want kids especially to be in treatment forever. That's not the goal. We'd rather them be out and about doing everything that they like to do and that they're good at. But if it's warranted, then it's important that, they get through these moments. So again, the goal is to really enable and empower these kids to have a certain skill set or a toolbox. So that way they don't have to rely on someone like me all of the time, and they can kind of take what they've learned and go off with it.
Yeah. And so for students, I mean, I can think of so many kids over the years that are just like, I'm anxious, or, you know, they're not necessarily able to pinpoint specific things that make them feel anxious. They just more identify as feeling anxious about things. How do you work with kids in order to be able to identify those specific sort of like triggers, or the specific things that make them feel those feelings?
Right. So another good question, because I think the word anxious is swirling all around. And so people sometimes say it, but not really fully understand what it even means. So sometimes we'll just prompt kids. And so for younger kids, we might give them a list of, these are common fears or worries that people have. Let's go through them, and let's try to, not to create ones that don't exist, but let's see if we can identify what you're experiencing right now. So that way they can look at something. And also, in addition to being able to identify from just a pre-existing list, they can feel like, okay, other people might be experiencing this too, and I'm not alone with that.
Yeah, and I'm sure that brings a sense of comfort, because those feelings can be so isolating. And so in theory, then, is the idea that once you identify the sort of trigger for some of those negative emotions, the idea is to help students learn a more productive way to cope and address those sorts of feelings?
Yes, exactly. So CBT is very goal-oriented in general. It's a little bit different from a term that's used, talk therapy. Of course, talk in CBT, you have to be able to communicate. But before beginning treatment, we really focus on goals and make sure there's a set treatment plan so that everybody knows what they're doing. And by everybody, I mean the child, the parents, the therapist, because it is really a collaborative process. We want to make sure that everyone knows what's going on and that nothing really unexpected comes up.
Yeah. And then in terms of working collaboratively, do parents often have to support their student or their child outside of sessions by helping them to identify sort of situations that might produce that anxiety and prompt them to be ready to respond with the new response or coping mechanism?
Yeah, so I'd say that generally with each therapy session, it's important to keep parents in the loop. And of course, this depends on age. You know, teenagers are less wanting of that a little bit. But for kids, you know, elementary or middle school age, I usually share with parents whatever skills that we worked on in the session. So that way they can have this time and be able to understand what they have to do at home during the week. So even if it's just, okay, we're going to practice this skill a few days a week, then that's something that will help sustain whatever the child has learned in our once weekly session.
Yeah. And how should parents identify if their child needs CBT or is just kind of feeling these sorts of negative feelings, but they'll grow out of it or it'll get better on its own? Is there any sort of guideline as to how or when to identify when it's time to seek help from a professional?
Right. So I think especially nowadays, families are particularly feeling the stress and anxiety. And so this relates to actually how I usually start with CBT in general, but I try to explain that a lot of these feelings we have and these uncomfortable feelings are very natural and normal to feel that way. So just because someone feels anxious doesn't mean you have to call up, you know, a clinic right away or call up your therapist. What I usually even explain sometimes is that this is very evolutionary in the way that we perceive threats or how we respond to what's going on around us. So in terms of general guidelines, we like to look for impairment across a few different areas. So for kids, it's how are they doing at school? How are they doing at home? If there are really recurring patterns that continue to be problematic for that child and the family, then it might be, and by recurring, I mean over the course of a couple of months, and there really is no improvement, then at that point, we would likely recommend treatment. So the thing is, though, every kid can really benefit from learning what's going on in their brains, their bodies, learning how to cope. But again, kids are also really naturally resilient, and so they'll compensate in certain ways and still be able to get support from teachers, caregivers, coaches. So there's not always that need right away.
Yeah. And, you know, just thinking about the fact that we are living in such difficult times and there is so much anxiety that we are all trying to manage. Are there any sort of simple or generalizable strategies that you can recommend for parents who are trying to support their kids who are feeling anxious about the world around them, or, school and remote learning, or, even for all of us as we watch and wait what the state of our world is going to look like for, however long. Are there sort of simple strategies that are helpful or useful that you could recommend?
Sure. So I had mentioned a couple of just the basic behavioral strategies early on, but deep breathing is one of my go-tos. I think that for kids, you have to make it more engaging. So if you're a parent, there are tons of resources online, but anything from belly breathing to pretending you're an animal and doing certain stretches to get the breath in can be very helpful for kids. Thinking about a place that makes them feel good or makes them feel happy if they're stressed are two. That would be another one that is part of my two go-tos. But then I think the parent piece, like you said, is really important too, because parents are feeling the stress right now. And so in the ways that they respond and react, the kids are going to pick up on that. So any way that they can model this distress tolerance and validate that, okay, these times are pretty stressful right now, and this is what we can do to get through them. So coping skills are important, but also just accepting that, okay, things are different right now. That's okay to feel the way that you're feeling. We're going to get through this together, to kind of give that sense of reassurance too.
Yeah. And I think in general, modeling behavior is such a positive way to show kids that this is totally normal and this is what happens in our brains all the time. But because it is in our brain, it's so difficult to see it. So, again, just like talking it through seems like a really great strategy, I'm sure, to help communicate the ways in which we can manage our emotions, even when they're challenging. Well, thank you so much for taking the time to talk to us today about CBT. I know it's an incredibly effective treatment for such a wide range of challenges that kids are likely to face, and adults as well. So, it's great to have your recommendations and your insights, and I'm sure that it will be of value for our audience here.
Great. Well, thank you again for having me. And I think it's a good reminder that we're all getting through these moments, and it's okay to also feel stress sometimes. It's not necessarily a bad thing. It's our body responding and protecting ourselves. So it's a helpful reminder to think about that in an adaptive sense too.
And we can all close this moment with a deep breath and feel good as we watch this waiting very patiently.
Yes, exactly.
Okay. Well, thank you again.
Yeah. Thank you for having me.